Okay, this video is the 10 Commandments of Healthcare. And please note, this is different than an earlier video I made, which was the 10 Commandments of the Vegan Diet, 10 Commandments of Healthcare. And the most important commandment written in stone in healthcare is you must follow the standard of care. And we will explain what that's all about. Okay, here's how it works. Number one, 10 Commandments, commandment number one, you must follow the standard of care to get paid, to protect yourself from a lawsuit. If you follow the standard of care, it doesn't matter if the patient dies, you can't get sued. Following the standard of care is part of fulfilling the requirements of the billing code so you get paid. The standard of care is almost always going to be to order a blood test, an imaging test, an invasive procedure like a colonoscopy or something, or a surgery. Things that make money. That's the important thing there. These are all things that make money. Talking to a patient, educating a patient, that does not generate a billing code. You don't get paid for that. You must meet the expectations of the referral doctor, and the referral doctor expects the standard of care. Every hospital, every clinic in the Western world has a bean counter. And the bean counter is kind of like big you-know-what, brother you-know-what. Okay? So basically, you must please the bean counter. And the bean counter basically is somebody who looks at your billing code numbers and looks at the billing code numbers of, healthcare providers at other hospitals, other clinics. And they're always going to say at every single meeting, well, you know what? There's somebody somewhere generating more billing codes than you. Therefore, you're kind of lazy, and we really want you to generate more billing codes. They never say billing codes make money, and we just want you to give us more money. That's what it really means, but they don't say that. Okay, the doctor's priority number one is they must please the bean counter. The thing that matters for a doctor to keep their job is the bean counter is happy. Okay, they must love big you-know-what, brother you-know-what. Okay, after they please the bean counter, they also have to please the insurance company. So what that means is you have to fulfill the requirements of the billing code so that you get paid, so that hospital gets paid, so that the bean counter gets paid. Then you must fulfill the requirements of the drug company guidelines, which are very similar to all of this. The drug company guidelines are based on the fact that at the big name universities that do most of the research for the big drug companies, they basically, the professors over there, they want to get promoted, so they have to beg the drug companies for money. And the drug company says, look, you play ball with us, you get money. We'll give you grant money, you make our drugs look good. If you don't make us look good, we give you nothing. If you make us look bad, we'll get you fired. So they always kiss butt to the drug companies. And then they write the papers that establish the guidelines, and the other healthcare providers have to go by those papers. That is the official standard of care. So you must please them. You also, like we said, have to please the referral doctor and meet their expectations. And notice that far, 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 far down on the totem pole of priorities is the patient. And the patient is typically some poor ignoramus who doesn't even know what's going on. And so, you don't have no obligation to please them other than, to pretend to be nice, okay? All hospitals and clinics will track productivity, and they're going to claim that productivity is a measure of quality. It's actually a measure of billing codes and a measure of dollars generated that they get to keep, okay? So that's what productivity really means. It's this idea that hospitals have been improved by the modern methods of running them like assembly lines. And the patients are called customers to have a throughput. They kind of got rid of the idea of the doctor-patient relationship decades ago. Okay, now it's healthcare provider and customers. Okay, and the faster you generate billing codes, the more money you make. Okay, I had one doctor who told me, why do I study so much? Why do I try so hard to make good presentations? All you got to do in medicine is just sell more hot dogs. Taking care of patients is like selling hot dogs. You sell more hot dogs, you make more money. And I'm like, you know what? It actually means a little more to me than that. Okay, the next commandment, number 7. Oh, no hospitals or clinics will ever track outcomes. You might see some small, limited tracking of outcomes to do a research study. You might see it sometimes in a surgical setting or interventional setting, imaging-guided surgery setting, to track outcomes with a new procedure, for example. But they're rare, special, isolated situations. You will never see them on a big scale for chronic disease. And the reason's obvious. If they tracked outcomes, somebody would come along with a low-fat vegan diet with no oils, and they would get by far the best results for treatment of obesity, hypertension, diabetes, abdominal pressure syndrome, leaky gut, etc., autoimmune disease, etc., etc. This cannot be allowed, and it will not be allowed, and it is never going to be allowed. It would make the drugs and surgeries look bad. No, no, no. Unacceptable. Okay? Now, if a doctor goes, kind of rogue and they start trying to educate patients, they're going to pay a very high price for it. First of all, they're not going to get paid for it. It's going to be time consuming. They're going to go home late every night. They're already working long, long hours. So now they're going to work super long hours. By the time they get home, eat dinner, and go to bed, they're fucked. Okay? They're going to be exhausted, and that just accumulates day after day. It's going to be tough for them to stay healthy themselves. Okay? So that's not a long-term winning strategy. Also, if they try to educate the patients, it takes time to talk to a patient. They're going to probably have a drop in their productivity. Not good. That's like that's going to piss off the bean counter. And first, they're going to get a warning. They're going to be told, well, the other docs in the clinic are seeing 30 patients a day. You're only seeing 20. You're not pulling your weight. You better start doing your share of the work. Stop being lazy, or we're going to have to let you go. And if it continues, they will be fired. So in summary, if a doctor were to try to actually cure the patient of all these chronic diseases, which are so common, diabetes, hypertension, obesity, and all the things they cause, coronary artery disease, impotence, gastroesophageal reflux disease, etc., they will be unable to pay off their loans because they're not going to be making the money. They're going to be physically exhausted and stressed out. They're going to be open to a lawsuit for not following the standard of care. They're going to get in trouble at work, and then they're going to be high risk to be fired. So sadly, many healthcare providers are faced with the dilemma, either F K the patient, or F K themselves. And in that setting, what do you think they're going to choose? And luckily, though, the very thoughtful and kind medical schools help protect the healthcare providers by not teaching them NETs. NETs means nutrition, epidemiology, toxicology, spirituality, sense of purpose, and all those sorts of things. Diet and lifestyle, basically, and toxicology. By not teaching them, the average healthcare provider is completely oblivious. They don't even realize that what they're doing is kind of ignorant and stupid. And that's actually good, though. It protects them from the psychological dilemma of realizing that there's a better thing that they could offer to the patient. The doctors actually who do get educated and learn all these things, that there's much more they could do to help patients, then they're stuck with the psychological dilemma of where do I draw the line between helping them and preserving my health and sanity and finances. So it makes it difficult on them. So it's much better for healthcare providers to be completely ignorant of anything other than drugs and surgery. So anyways, after you see all this, basically it's a choice between this or this or this. I wonder why doctors almost always go by the standard of care.